of you had this demonstrated. But classically in teaching, we talk about end feels. We talk a lot about end feels. And if we have a pathological end feel, and this has been shown by studies of different groups of therapists, it's easy to pick up a bony end feel, easy to pick up a slack end feel. But when we ask them, those same groups, what's the end feel of the knee? What's the end feel of the hip? They're all over the map. Because now they're looking at normal end feels. So I'm going to just show you something very quickly. I'm going to take his knee, and we know from the screen last time that there should be a little bit of hyperextension in the knee to function normally. Might have found the culprit. Right. No, he's just naturally stiff, but he should have more. He should have more than that. But anyway, that's good. It's rigid. So now don't let me lift your heel off the bed. And relax. Just relax. Hold again. Relax. So I've just increased the hyperextension in his knee by about 5 degrees. Has that damaged him? No, we're just playing a little game. We're playing with the central nervous system. In other words, every end feel you feel in a normal joint is muscular. Muscle limits movement in a normal joint.
And so you sensed a lack of conjunct external rotation at terminal extension, compared it to the other side. They were close, but there was a little bit different end feel on the right than the left. So you did a muscle energy technique to ramp the muscle down.
Yep.
To get the real feel.
Yeah, see, it was interesting, they did a study in Hawaii on knee replacements. And that's why I went to Hawaii to get a consult for my knees. Never followed it up though. And their study showed that almost all knee orthotics limit extension to 0. And they have a life expectancy of so many years. 5 years, I think, was the outset before it started to show signs of wear and tear. And now they've obviously decided it's because we didn't produce or give them a little hyperextension, which we need. So now that's the latest mode. And the latest one, because the surgeon showed me they put in 2 separate orthotics now, one in each condyle, or at least this surgeon does, and they're about this big. It's like, I said, is that going to work? He said it works perfectly. But it does give you a little bit of hyperextension. But the interesting thing is, while he's there, it stays the same. Just step down for me. And you know, when we did the last course on the thorax, I kept saying, don't let them stand, right? Before you do your neuromuscular education, get back up. And this is the reason. As soon as he stands, his midbrain resets everything, and now we're back to normal. So I know we sound a little bit emphatic sometimes about things, but there are reasons for it, and that's one of them. And that's where, for many years, we studied under the osteopaths, looking at muscle energy. I don't know how many of you guys have ever done those courses. But you'll notice they would assess people from a positional perspective. Then they do their hold, relax, da, 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 and then they'd reassess. But they didn't do it after weight bearing. And that's what I found was mysterious, because I could set somebody's pelvis in any position I wanted. As soon as they stepped out, it all went back again. And then, of course, you always get this question, okay, well, why does it work? Because I use it and it works. It's like you're playing with the central nervous system, right? That's why it works. You can change pain, but can you change structure using muscle energy? And the answer is no. The only thing that's going to change that is the central nervous system and repetitive exercise. While we're on that, did you do frictions in your Comp 1, Comp 2?
Mm-hmm.
And what was the reason you do frictions?
Pain modulation for
Sorry?
pain modulation, like resetting the
Yeah,
nervous system.
definitely pain modulation. But do you think it does anything structurally? Classically, it helps to realign collagen fibers, but of course the studies done on horses, unfortunately, show that doesn't work. The only thing that changes collagen orientation is repetitive exercise. And what we're doing when we friction is we create a piezoelectric effect, which will then enhance that ability for movement to change collagen. Okay, so